Okay, so we are recording the session and let's begin. So as I was saying, Eastside Baby Corner has partnered with HealthierHere for a COVID-19 information campaign as part of Seattle King County Public Health COVID Awareness Initiative. Today, we are very proud to collaborate with our partner, Seymour Community Health Centers, to bring you a fact-based webinar for you and your program recipients. All these partners that we work with, it's a webinar named Straight Talk about COVID-19 vaccines, testing, and more. This is basically our attempt to address the most frequently asked questions and misunderstandings about the current pandemic. And we are grateful to have CMAR partnering with us to share the knowledge. So here we have a team from CMAR from their Bellevue clinic. We have Dr. Neha Yadav. She's MD. She's Medical Director, Family Medicine.
Family medicine.
We have Miss Virginia Ramos. She's a nurse manager, infection control nurse. So keep all your questions ready because she's the one who's going to address all the questions along with Dr. Neha and Mr. Jeremy. So the next one, we have Mr. Jeremy Vargas. He's at the health center. He's an administrator, and he has been the main person I was communicating with and bugging him for last week or 10 days. So thank you so much, Mr. Jeremy, for all your patience. So Dr. Neha, Ms. Virginia, and Mr. Jeremy are going to be our presenters for this morning. There are a couple of things that I wanted to remind everyone about, and I have put them in the chat. So if you have any questions, feel free to put me a private chat message. So basically, you started with introduction. Thank you so much for keeping everyone yourself as mute. We are going to have some time in the end for question and answer. So if you have any questions, please address that as question : whatever question you have, so that I will make sure to ask that question at the end rather than everybody asking the question. And as you heard, we are recording the session and we are going to make it available for your future reference. And if in case you have questions, please feel free to reach out to me. With this short introduction, I'm going to request Mr. Jeremy to begin with his presentation. So
Hello,
Jeremy, if you
everyone.
can share your screen.
Hello, everyone. Thank you for attending. And my name is Jeremy. I'm the administrator for Seymour Community Health Center here in Bellevue. And it is our pleasure to make ourselves available for this presentation. Can everybody see my screen now?
No.
How about now?
Now. Yes.
All right. Well, what we wanted to start is with a brief introduction on CMAR as an agency. And of course, this is a presentation for Eastside Baby Corner. Well, Seymour Community Health Center started around 1978. And as of today, we operate within about 10 counties around or across the I-5 corridor from border to border, you should say. We have about 36, almost 37 medical clinics. As of last year, we saw about 3,000 or 310,000 patients, and we completed close to over 1.7 million individual visits or encounters. Our mission is to serve the community. We are a community-based organization. We're committed to providing quality, comprehensive health, human, housing, and educational and cultural services to diverse communities. And over time, we had specialized over delivering our services to Latinos. So throughout this last 40 plus years, we became a multi-services organization. I'm proud to present to you with our providers here at the CMAR in Bellevue, Dr. Neha Yadav, who is our medical director, Dr. Ralph Havens is a family medicine physician, Dr. Arika Aurora, another family medicine physician, Dr. David Tran, he's a pediatrician, and Heather Engelsman, she's also our nurse practitioner, and she's here every Saturday. Your presenters. I wanted to make a special announcement for Virginia Ramos. She's our nurse leader for the entire organization, and I want to thank her for the time that she's spending with us today. She's also the infection control nurse for CMAR. Virginia, you'll get a chance to say a few words. All right, so what we wanted to do is have three expected takeaways from today's presentation. First is to share what we've been doing with regards to COVID-19, our testing and vaccination practice as it stands right now. Also be able to demystify any misunderstandings regarding the vaccine, and of course, engage you as community partners and look at our overall focus to slow the spread. All right, well, I think we know that we face a very crude reality. This virus, the COVID-19 pandemic, has impacted everybody, as we know. That's, I don't need to mention that. But evidence does show that there's been a greater impact on the Black and Latino community. Of course, we've been marginalized and vulnerable communities as well. And this is why we are very eager to put most of our efforts, if not all of our efforts and resources, to attend to this pandemic. Now, there is also hope, and this is something that we're excited about. We qualified to receive the vaccines. All of our clinics will be able to receive the vaccines and deliver the vaccines when available. So vaccines do prevent COVID-19 and are perhaps seen as the only sign of hope to try to get ourselves to some sort of a normal. We know that the vaccines do provide and they build immunity to the virus. And if you should be able to get once you get a vaccine, or the vaccine will be able to keep you from being extremely sick if you do get the virus. And so that's the point of it. All right. So for this presentation, I wanted to start by quoting our main source of information. Our practice has been following strictly CDC guidelines, along with recommendations from the Department of Public Health, from the state of Washington, and our practice here, which is located within King County. We're also following King County guidelines as well. All right, well, let's start with the vaccine. There are two terms related to vaccine where we could talk about vaccine efficacy and vaccine effectiveness. And these two terms are usually interrelated, and they're used almost the same way. Now, vaccine efficacy refers to when a study is within the ideal conditions, like on a clinical trial, for example, you have very controlled conditions. Now, the effectiveness is when the vaccine is being deployed or studied within a typical field, like around the population, right? And so just wanted to make sure that we understood those. Those are two, those measure the level of immunity, right? The vaccine that we have been delivering here within CMAR is the Moderna vaccine. And it provides a 94.1% effective for preventing the COVID-19 illness. Questions about the vaccine: is it safe? Well, we understand that we know that the vaccine is safe. All COVID-19 vaccines have been used and have gone through rigorous testing to make it as safe as possible, right? And this has been studied by the CDC, and we know that the FDA has granted emergency use. All questions about if you're pregnant and if you're breastfeeding. Well, we know that people who are pregnant can receive the vaccine, but we as a healthcare agency, we have providers available, and we'd like to make ourselves available to the community. And so you should really consult with your healthcare provider so they would be able to answer those questions and help you make an informed decision whether, if you're pregnant or breastfeeding, if you should get the vaccine. Now, we also know that there's no data available on the safety of COVID-19 vaccines on lactating women and or on the effects of mRNA vaccines on breastfed infants. Now, if you have an underlying condition, you should get the vaccine. Now, we can talk about which underlying conditions these are: hypertension, diabetes, obesity, lung disease, cardiovascular disease. These are the five most common or known medical conditions uh, that that show that if the majority of persons were hospitalized that had COVID-19, they were adults that had any of these medical conditions, and so therefore it's recommended that people with these medical conditions get vaccinated. Another common question we've received is, why do we need to have two doses? And to put it in simple terms, and Dr. Yadav, I think you may want to comment on this later, is the first dose acts as a primer. So it helps the body's immune response to begin to build some immunity. And that takes about a period of 25 to maybe 28 days. And the second dose is known as the booster, which will strengthen the immune response to provide sufficient protection. That sufficient protection is known as efficacy, which then is measured at a specific percentage level. So what we want to do is achieve that 95 plus higher percentage level in terms of efficacy. Right. Now, we understand that there are multiple barriers that are preventing our community from being vaccinated. Number one is supply. We don't have enough vaccines available. We know that. The second one is location. The vaccines are going to be distributed strategically, but not everyone may be able to have the means to get to the vaccination centers. And so now we're going to have a brief discussion or a brief comment on the social determinants of health, such as language. Some people may not understand, or have the ability to read the materials to know what would make why they need to have the vaccine or how to get it. Then there's also transportation, and then access to information as well as education. And so we hope that as we share this information, we are able to at least address two of these, which is access to information and education. We want to be able to demystify some of the common misconceptions about the vaccine. All right. Well, we hear that the vaccine is not safe because it was developed too fast, right? Well, that may be true, but the vaccines were actually involved in new technology. Well, it's not new technology, it's been in development. And, the vaccines were tested in clinical trials involving thousands of people to make sure they met the safety standards to protect adults, especially those over the age of 65. Okay. Any serious issues were found during trials? Well, before the vaccines arrived to the state of Washington, they passed a rigorous rounds of testing, especially through the Food and Drug Administration and the CDC. And also the state of Washington performed this due diligence as well. So we can say that these vaccines have undergone the most intensive safety monitoring in our times. Here's another common misconception. If I had SARS-CoV-2, which is if I've been sick with the virus, is it not safe to get the vaccine? Well, data from clinical trials indicate that the mRNA vaccines or the COVID-19 vaccine can be safely given to someone with prior evidence of infection of coronavirus. And we want to say that the vaccination of persons who have had current infection should be deferred until the person has met the criteria for them to discontinue isolation. So meaning that we don't want to vaccinate you at the moment that you have just acquired the disease. You want to wait until you overcome it, and then you're able to build immunity. There are severe side effects on getting the COVID-19 vaccine. Well, people.
I'm sorry, can you please repeat that again? I didn't follow
Oh, sure.
the previous part. Like if you get the vaccine and you get infected or you get sick, then you should wait for the second.
Well, let's just say that if you, and I'm happy to have a doctor comment on this right here. Dr. Vidal, would you like to answer that? Or maybe we should table this until the end.
Sure. So, I mean, the vaccine is pretty safe for the people even after they get the COVID infection, as far as it's done after like they're recovered and after the isolation is over.
So what I didn't follow is if you get the vaccine and you get sick with the COVID-19, should you get the second dose or should you wait until you're healthy again? Yes.
So even like if you get infection after the first dose, then it's usually like you should still wait till you completely get better. The 10 days or the isolation or when your health department lets you go out. So once you're, yes, it's the same thing. So if even for the second dose, you need to wait till you're recovered. And after that, you can get the second dose. Did that answer the question?
Yes. And if I mean, I'm just worried for the second dose, would it be on time, to get the second dose?
Yeah, so I mean, there is no data supporting like, how much it would be delayed. I mean, it's good to have it within the month time frame, but even if it goes beyond, you can still get the second dose and there's no need to repeat the series.
Thank you.
Yeah, this is Virginia. In regards to the second dose post-infection, like it was mentioned, you do wait until you are completely after the isolation period and prefer asymptomatic because the second dose does, you have a higher, you mount a response a little more. And so the data shows that there's more symptoms for this with the second dose. Having said that, though, for Moderna, and this is on their guidelines, that you can actually get the vaccine out to the 42nd day from the first dose and still receive the same level of efficacy. So although we really want to vaccinate everyone on the 28th day, there's a 4-day window prior to that and out to day 42. And that's evidence-based data there.
I'm hoping that answered everyone's questions. All right. So here's another question or misconception. There are severe side effects of the COVID-19 vaccine. Well, some people may have a short-term or mild moderate vaccine reactions that usually won't cause any serious complications or injury, right? You do feel a sore arm, maybe a little bit of temperature or anything. Now we know that 10 to 15% of people who have received the vaccine, they do report reactions like headaches, chills, fatigue, muscle pain, and or fever that may last a day or two, particularly especially after the second dose. Now, these reactions are common because the body is adapting and you're building immunity to the virus. And here's another question here. If I had prior coronavirus infection, then I don't need to be vaccinated. Well, due to severe health risks associated with COVID-19 and the fact that reinfection is possible, you should get vaccinated, right? Well, it's now recommended a minimum, minimal interval between infection and vaccination. Evidence suggests that the risk of coronavirus reinfection is low in the months after initial infection, but may increase in time due to waning immunity. So if you got sick in January, you may be prone to getting sick again on April. God forbid that. Right? COVID-19 vaccines will put a microchip in me to be tracked. Well, there's no truth in this myth. Uh, the ability to embed a microchip in a vaccine just does not exist. The COVID-19 vaccine will cause infertility. Well, there is no evidence to back up this rumor. You know, it was just a rumor that started in the internet, but there is no clinical evidence that does support this. After getting the vaccine, will I test positive on a COVID test? The answer is no. The COVID vaccine does not cause you to test positive if you get a COVID-19 test. Now, tests are the way the tests are designed is to see if you have an infection or if you're sick with the virus. Here's another question. Once I get the vaccine, I won't have to wear a mask or worry about social distancing. That's not true. People should continue to wear a mask around others, wash your hands, practice physical distancing as much as possible. And while both of the vaccines are being used in the United States, do require 2 doses, and that takes about 3 to 4 weeks apart in order for you to be well protected. There can take several weeks for your body to develop enough antibodies to protect you against the virus. So after you get the vaccine, you do need to continue to take the steps to protect yourself and people around you. Here's another common misconception. Can I get COVID-19 if I've had an allergic reaction to the vaccine in the past? Well, we want you to be careful. The COVID-19 vaccine should not be given to people who have had any serious or allergic reaction to any other mRNA vaccines, right? That's the disclaimer, right? Every vaccine will tell you that. But we want you to consult with your provider, and we want you to know if you have any history of developing any allergic reactions. We want you to consult with your provider. Should I get this vaccine if I'm on chemo or have HIV or have a problem with my immune system? Again, we want you to consult with your provider first. And I like to put a space holder here because I think our doctor may want to have a few comments about this, especially as it relates to having an a compromised immune system. Dr. Yudav, would you like to say anything?
Well, as far as I know, like, it's a kind of consult, like case by case basis with your provider. In case like you're getting any treatment, any medications, but so far, like it's the risk versus benefit. So I think, protection from getting the infection is way far from any of the side effects from those vaccine. So it's still recommended to get the vaccine, even for immunocompromised patients, but it's kind of a case by case, like an interaction and discussion with your provider.
Thank you. Can the COVID-19 vaccine make me sick with COVID-19? Well, no. The answer is no. These vaccines do not contain the live virus. And then, there are different types of vaccines and they're made differently. This vaccine does not contain the live virus, so it will not make you have COVID-19. Now, you may have symptoms like headaches, chills, fatigue, muscle pain, and that's normal. But these reactions are just very common, especially after the second dose. If I get the vaccine, how long does it take for it to work? Well, it typically takes your body a few weeks to build immunity right after you get the vaccine. We want to allow your body enough time to adjust, and so that you know that you've had enough time to provide sufficient protection. And the period that we understand is about 3 to 4 weeks after the second dose. Will a COVID-19 vaccine alter my DNA? The answer is no. The COVID-19 vaccines do not change or interact with your DNA in any way. They actually teach your immune cells how to make the protein that will recognize the virus when it invades your body. That does not mean that it changes your DNA, right? Now, the mRNA from COVID-19 vaccine never enters the nucleus of the cell. We can get very technical here, which then would alter your DNA. This means that mRNA cannot affect or interact with your DNA in any way. So basically, the math and the science wouldn't add up to do that. It's just a very common misconception. Let's talk about how can we get vaccinated. Here in the state of Washington, we're following the phase approach. Within the winter time, we have two tiers, tier 1A and 1B. Tier 1A has, 1A phase has tier 1 and tier 2. 1B phase has one tier, and the 1B phase has also involves tier 2. Now, I don't want to make this more complicated, but within the winter time, what we're looking at is to vaccinate everyone who will be a high-risk healthcare worker, first responders, long-term family, long-term care facility residents, and all workers who are in a high-risk health setting. Now, regarding patients in our population, people 65 years or older, and or patients or people who are 50 years or older who live in a multi-generational household. And then that's our sole focus for this stage in the phase approach. Is there a cost? No, there's no cost. The vaccines are free. If Seymour has made a commitment to the community and its patients to deliver the vaccine free of charge. We won't even charge the application fee or the fee that is usually charged with delivering the vaccine, which is paying for the nurse to inject. So there's no fee at all. And we just want you to be eligible, an eligible member of the community or within our patient base. Where can I find the vaccine? You may be familiar with the vaccine phase finder. The URL is here, and then I placed the logo there so they could be recognized. Now, within the Seymour system, we would like to invite you to visit our website. It's updated hourly and providing updates as to which clinic has the vaccine. Now, how are we delivering the vaccine? Well, at this moment, we are delivering the vaccine on a first come, first serve basis on a walk-in system at the locations that actually have the vaccine. Again, we'd like for you to refer to our website because that will have the most updated information. All right, we can talk about testing. See if this works. All right, where would you be able to get tested? Within King County, if you'd like to visit the King County website, there will it shows you locations within King County. So there are several locations. We have Auburn and Kent, Bellevue, Des Moines, Sequoia White Center, Duval, Enumclaw, Federal Way, Renton, Seattle, Shoreline, Vashon Island, and you can even do a testing by mail. This map depicts the geographical locations of placement across King County where you may be able to find a testing site. Here in the east side, we are known of two. Here within our clinic in Bellevue and at Bellevue Community College, just up the street across I-90, there is also a drive-through system as well. Within the Seymour system and the clinics in King County, we have 5 testing locations in Bellevue, Federal Way, Kent, Seattle, and White Center. We'd like for you to connect the clinic or look at the website for each clinic so that you could have a better idea on the testing times and testing days. And it's always better if you make an appointment. Here's another question we've often get. How often should I get tested? Well, we recommend that you get tested when, if anybody has symptoms, or if you know that you have been exposed to someone with a confirmed positive case. Also before and after necessary travel. And I'll give you an example here. Well, some healthcare workers are required to get tested weekly. If you think you may want to visit a family member who is at risk, and you want to just have the certainty of walking there with a negative test, then we would recommend testing. Now, there were some questions about false negatives. Well, what's a false negative? It's if you get a result that says false, but you actually do have the virus. Well, false negatives usually occur when someone tests too soon. Some point of care tests are known to have a margin of error of about 20%. Now, we want to be able to find the optimum time for testing. And so that should happen between 3 to 5 days after exposure to a confirmed positive. Now, how could we avoid COVID-19? I think that's everyone's known, but I wanted to make sure we touched on this just a few points before we ended this presentation. Now, we want to continue to reinforce washing your hands for at least 20 seconds. Use the alcohol-based sanitizer like Purell. Avoid touching your eyes and nose or mouth with unwashed hands. I mean, stay away from people who are sick. Stay at home as much as possible, right? Practice social distance when you're out. Please wear a mask. The masks do work. I can tell you that. We've been working here at this clinic here for a year, and nobody in my clinic has gotten sick. Now it's been, I think maybe I'll just attribute that to some luck or goodwill. However, masks do work. I tell you, no one in this clinic has been sick, and I intend to keep it that way, but we've been very careful. We want you to continue to clean and disinfect surfaces you touch, like your doorknobs, your cell phone, your keys, your credit card, and get a flu shot as well. And that concludes our general presentation, and I wanted to leave this time and open for questions. If you have questions, here's my email address. And I'm going to stop presenting so that we could enjoy each other's companionship.
We're trying to figure out why it says chat is disabled. So give us just a second. But I did see one question while Ruchi's trying to figure out the chat. Someone asked, now they are saying with the new strain, we might have to get a third dose now. Is that true?
Well, what do we know about that?
That's still, this is Virginia, so that's still under review right now in regards to, whether Pfizer or Moderna are creating a booster vaccine. So all of this is relatively new. So I would stay tuned in regards to guidelines and, whether or not an additional booster will be recommended. That's the latest information that I have. It's just really important, as Jeremy was saying earlier, to complete your series that you have now. Get the 2 doses in the appropriate intervals, and then we'll stay tuned to see what recommendations are had in regards to the new strain or the strains that are out there now.
So thank you so much, Virginia. I have a couple of questions here, and I will take the questions in the chat box. And thank you so much, Mr. Jeremy, for insightful presentation. And thank you so much, Dr. Yadav, for chipping in. I'm sure there would be a lot of questions for you all. So the next question I have is, what is the difference between 2 types of vaccines, the Pfizer and the Moderna? Whoever wants to take the lead between 3 of you.
Dr. You want to take a stab?
Well, they both have the similar technology. They're both mRNA vaccines, and they were both developed around the same time. And that there's the active ingredients are actually publicly known. What would be the difference is the brand name.
Okay, thank you.
Yeah, I mean, you could get, if you get technical, you can look at the composition of each vaccine, and they both have lipids and different proteins and sucrose, and there's a lot of different ingredients or similar ingredients, and then there's one that'll make it unique to that particular vaccine. So, but as Jeremy was saying, they're both mRNA vaccines, and so they both function or work very similar to each other. It's just the actual composition of the vaccine itself.
Great, thank you. The next question is the system in place to make sure people are receiving 2 doses on time?
The answer is yes. And as we mentioned earlier, it's a supply versus demand challenge. We do have here within Seymour, we've built a capacity to deliver vaccines. As long as we have them, we'll deliver them. And I think every clinic has been ramping up to have sufficient staff, to have the space available to deliver the vaccine. And if you give us the vaccines, the doses, we'll deliver them. I think that's the best way to answer that for any questions related to that.
And I can also add as well that although we do, our vaccines on a first come, first served basis for the first dose, the patient or the person who gets the vaccine will leave with an appointment for the second dose. The only times that we've had to reschedule is if the doses haven't been shipped out. So this is a particularly unique week, due to President's Day and then the storms. They have impacted the delivery of the doses. And so we're working really hard to modify our schedule so that we can kind of time when the second doses are going to be arriving. But everyone leaves with an appointment for a second dose, because that's really important, for us to be able to send reminders and make sure that people come in for their second dose.
Great, thanks. Is vaccine effective against the variant? I know we talked about the variant, but if we can address this question too.
So there is, I'll step in. So the Pfizer and the Moderna each have statistics in regards to our, some evidence-based studies in regards to the strains that are covered. So the strain from the UK with Moderna, it is covered to a certain level of efficacy, and also for the I think South African one, but not as high. So there's some coverage, but I wouldn't say that it's at the same efficacy as the 94.1%. So that's why there's a lot of research going on and some studies in regards to boosters, or where, if you think back of during the flu season when H1N1 came out, remember everybody got the flu vaccine, and then we had this mass, rush into to get the single antigen vaccine. So as a nurse and having seen these kinds of things before, I'm wondering, if the third booster won't be available, or will be required, that's more specific to those different strains, but don't quote me on that one. But I suspect, because like I said, you kind of look at what things, things that have happened in the past, and I vividly remember I was a nurse back then, so doing that mad rush to get that the antigen specific booster back during the H1N1 crisis.
Great, thank you. Do patients have choice of manufacturer for the vaccine?
We wish that there would be a way to provide patients with the choice. However, we're at this moment, we are just responding to whichever vaccine has been made available to us. Now, there are two things that are very practical here. The Moderna vaccine has storage and refrigerator requirements that are more adaptive to an environment like within the clinic. The Pfizer vaccine requires an ultra low temperature, which is maybe more feasible for a hospital or a larger health system to have. Now, I think at some point, we may be able to deliver the Pfizer vaccine. And if we were to have the proper refrigerated systems, which I'm gonna hope that it's something that it's coming real soon.
That is interesting. Thank you so much for sharing about the storage requirement for different vaccines. Are the guidelines for the Pfizer vaccine similar to Moderna?
Would you be able to specify what you mean by guidelines?
Kathy, would you like to unmute yourself?
The question has been answered, so thank you.
All right, thank you.
Okay. So what are your thoughts on double masking? Are there certain situations where it is more important?
That's a good
So
question.
I can answer that if you'd like. So, there's a lot of recommendations there. There's a lot of talk about the double masking. The CDC did actually put out their recommendations for double masking. And one of the things that the focus really is on the fit of the mask, right? Because you can have, two layers, and then if it's not, snug and it's not fitted well, then obviously it's ineffective. So the guidelines are really for I think the community. I think for us in healthcare, and we have level 2, level 3s, we have different types of masks. So we are not currently, at least here at Seymour, not recommending the double masking for healthcare workers, because we have the different levels for depending on the level of exposure that you may have in regards to the direct delivery of patient care. But for the community, it's more about making sure that you have 2 layers. If you're wearing like the gator masks that are really not highly recommended, you do have to kind of fold them and have them have a double layer. Obviously, it can obstruct your ability to breathe or whatnot. But we should follow the guideline, the CDC guidelines. And so when you're using a double layer, it's more about getting it fit to your face and wearing it appropriately than really the type of mask that you're wearing. So let's say that you're wearing a surgical mask, you could then put maybe a bandana over that just so that it's a snug fit. So that's really what I think that's what I took out of the CDC guidelines. It's really, really about how you're wearing it and does it fit well.
Great, thank
That
you.
answers your question.
I think so. I did not hear back anything. So there's another question. I read somewhere that Johnson & Johnson was developing a vaccine as well. Do you have any information on it, or if it became available, or when it is going to be available?
I'm gonna take a stab at that one. We understand that the Johnson & Johnson vaccine, it's will only require 1 dose, and it may have a certain level of protection, very similar to the mRNA vaccines. When will it become available? We don't know. We'll know just as much as anyone else will know within the community. So soon, I hope. I think it'll become available when the FDA grants its emergency approval. When will that be? We don't know.
Mm-hmm. The next question is, why is one vaccine for children 16 and older and the other one for people 18 and older?
I can answer that. So the age difference is really based on the individuals that participated in the study. So Moderna did not have or doesn't have data for that age group as of now. So that's why one can go, can start at the age 16, which is the Pfizer, and then the Moderna at 18. And that's, like I said, it's just basically, that's what they did their research on, and the number of individuals that were in the actual study.
Great. Any other questions? I think I asked all the questions. Corey is my backup who's looking at questions too. Corey, did I miss any question?
I don't think you missed anything.
Okay, cool. Thank you.
Yeah.
So
If I could add just a couple of things, just some things that came to mind when we were doing when we were going through the presentation, and thank you, Jeremy, for that. So there are a lot of questions too that are coming up now that people are fully immunized and whether they can travel or not. And then all of the infection control protocols that were once in place. And so for travel, right now the CDC doesn't have guidelines for domestic travel. I think that's left up to the state, but for international travel, they do have guidelines in regards to what happens if you're vaccinated versus not vaccinated. They are recommending that if you've been vaccinated, that you wait at least 2 weeks before leaving, so that your body has enough time to, mount a response and get enough antibodies for protection. And then you still, the quarantine, I think when you come back, maybe depending on the organization you work for, maybe less. Or just with monitoring versus isolation and quarantine when you get back. So please work with your own health facilities in regards to those guidelines. It doesn't give you free. It doesn't say, well, because I'm vaccinated now I can go about and travel or whatnot. It's really important to know that it protects you, but you still have to wear your mask, physical distance. Don't go to large social gatherings, and so all of those things are really important, even if you're fully vaccinated. And so, like I said, the CDC has guidelines in regards to international travel only. So if you're going to travel, domestically, then you need to really, look and see what the Department of Health, has to say, but more or less, again, making sure that we're following our infection control guidelines that are being asked of all of us just to stay safe, even though you've been vaccinated.
great. Thank you so much for more information on that and clearing out any questions we may have had. I just have a quick question for the CMA team as total. So since it's a community health center, you definitely are seeing more and more people coming in, getting vaccinated, or even for testing and stuff like that. So what are your observations at the community level as to what are the challenges that you feel community is facing as far as navigating themselves through the pandemic? I mean, you may not want to talk about the challenges that you have already spoken, like the barriers that you have already spoken in the presentation, but just for all our community organizations, like partners, to understand what is that one thing that you are dealing with the community, which they will be able to, help through their programming efforts and stuff.
Well, I think we have very unique challenges ahead. As we understand that this pandemic, it's not over. And there isn't really a way to tell how many more months or years. But if we look back in time, we may be able to see that we're probably about 33 for maybe 40%, of the time has already passed that usually a pandemic will last. The challenges that I see that we have ahead is just being able to continue to demystify the issues around vaccinating. Once the vaccines become available, we will be able to have them, and we'll have the ability to vaccinate large numbers of groups. And then once that becomes available, pardon the noise. Once that becomes available, then we want to be able to have as many people as vaccinated, and to continue to respect that, during this time, where as vaccines become available, then there's still, the virus is still going around. And so the quicker that we're able to vaccinate a group of people, the less of a chance we'll be able to have of recurrent reinfections, or for the virus to have the opportunity to have other variants, right? And so that's the only challenge we have, is just an issue of supply and demand. Now, I mean, I think that our challenges are great. However, they're not as great as those challenges on other countries, like developing countries, where the access to healthcare isn't something that is just conceptual, right? I think that either way. So I know that we do have our challenges, but I know that as we had challenges just last year, just with being able to get PPE, or being able to get the community or people be responsive enough to respect social distancing guidelines, or wear a mask, and practice the basic sanitation techniques. Those are challenges at that beginning. I can think about a year ago. Now those challenges have been overcome. Now challenges in the near immediate future will just have to do with supply and demand. The more vaccines that we're able to get to people in the faster amount of time will create a significant reduction in post reinfections. Now, right, we're going to get to March, and then April, and then another flu season's coming again. And so the more that we do right now, the better it'll be. And so we're prepared to do it as long as the vaccines are available.
Great. Yeah.
And if I may add as well, I think too that some of our unique challenges is, because of the community that we take care of, many of them are essential workers. And so these are not the people that can work from home, therefore decreasing the opportunity to be exposed, right? So if you're an essential worker and you work at a grocery store, or you work, at one of the local, smaller businesses like the local restaurants and those types of things, obviously if you have to work from, if you're an essential worker and you have to go out into the community and work, well, then your exposure, becomes, more significant because you're out more. And so I think that's really what has impacted our community as well, is that many of them are those essential workers that go out into the community and can't work from home. So I think that's what I've noticed, the most. And then the fact that, where they're tiered in regards to getting the vaccine, right? Essential workers are the next phase in. And so we're very anxious to get as many doses as we can to get, vaccines in arms and get those essential workers vaccinated as soon as possible. But that's what I feel that I've just from observation. This is anecdotal. This is just, me here at my clinic, as I'm also the nurse manager at the White Center Clinic. And so that's what I've seen a lot.
Great. Thank you so much for that informative answer. So I have two questions before probably we end. So the one question is, any information about why they just approved this method for vaccines, like the mRNA, and why was it not approved for a long time?
Well, that's a really good question, and for which we could only speculate. I don't think I'll give you a reasonable answer without just trying to find or trying to cite some sources that just have to do with hard science. Yeah, good question. I wish I had a better answer for that.
Thank you. So the last question we have, how can someone keep themselves safe if someone in their household contracts COVID?
Well, that's a good question. We've seen that a lot. We would like to recommend that if people within the same household also practice the social distancing, and I know it's happened a lot here. I mean, we have a patient and that lives with 3 other people, and these 3 other people never got the virus because that other person stayed in their room until they felt better. They washed their own clothes, and they did their own thing, just apart from everybody else. Now that, that happens, but they just have to practice social distancing and isolation as much as possible. Wear a mask even inside your home. Wash your hands and wash everything you touch. So I think that'd be the best answer. Dr. Gadab, I'm not sure if you'd like to comment on that, or Virginia. I mean, because this was one of the things that we had to do, almost recommend to every patient, right? Every patient was a multi-generational household patient. Most of the cases that we received here, we saw here, where it was just one roommate within 5-7 people living in the same house.
We are fortunate here in King County that if you reach out to our public health jurisdiction, there are some isolation facilities where you can actually, go and stay during your isolation period, so that other household members aren't also exposed and then, end up also positive. So that's, we have, as an agency, have reached out and have used those accommodations for employees and for patients that have been able to go and stay in one of the isolation facilities. So that's the I guess the easiest one, right? Because you can separate that way. But if you're going to stay within the household, as Jeremy was saying there, masking, having a separate bathroom is really important. And then obviously not, dining together and really isolating yourself and segregating, yourself into a different area of your home. It's really hard when, like Jeremy was saying, that there's, multiple generations living in one household, and, they're sharing bedrooms and those types of things. And that's when it gets really tricky, and you really have to hone in on the masking and the hand hygiene and the disinfection and those types of infection control, protocols and, things to do at home. The CDC does, or the Department of Health actually does have some handouts that you can actually download that help the families when they're caring for somebody that is actually positive as well. So that is a really good point of reference if you need to have get handouts and whatnot. They're available for everyone to use. So.
Great. Thank you so much. Thank you so much, everyone, for your valuable time this morning. I know this was kind of a short notice, and everybody managed to spare their valuable time for this information. Thank you so much, Jeremy, Virginia, and Dr. Yadav, for your valuable time and making sure that all our questions are answered. This is really, really valuable. And I hope that we can continue with our collaboration moving forward as well. So thank you so much, and stay safe, everyone.
Great. Thank you. What a pleasure to see you. Thank you.
Same here. Thanks. Bye. Take care, everyone.
All right. Bye.